Hello, everyone, and welcome. Apologies for our delay. We had a few technical difficulties, but we're very glad to have all of our panelists and speakers join us today, as well as all of you. I think we have about 100 attendees and climbing right now on this webinar. Very happy to have each of you and hope that you can stay for the entire discussion, which I'm sure will be quite fruitful. My name is Lois Pace. For those of you who don't know me, I'm the President and Executive Director of Global Health Council. And for also those of you who might not know, Global Health Council tends to host a number of events on the margins of the World Health Assembly, which of course took place virtually this year. This is at least one event that we wanted to host this week with the expectation that we will all reconvene in the fall for a continuation of those proceedings and have another opportunity to come together either in person or online again. But I just wanted to formally welcome you all to this particular discussion on the evolution of public-private partnerships, and some of our thinking around this, pulling together this panel and this conversation was to really highlight some of what we're all learning real time in light of the pandemic. I think there are a number of lessons to be considered, and perhaps public-private partnerships among them, particularly since we have come to view these mechanisms as critical for our work, and yet I'm not sure that they have been tested in quite this way. And so in light of the current context, we wanted to bring together a range of speakers who can have a discussion about what public-private partnerships really look and feel like amidst the pandemic, frankly. What lessons are they learning real time? How are they sort of reshaping their relationships or protocols? And what success are they having, honestly, as a result of coming together? Because at the end of the day, we all also know that it's going to take all of us to address this very issue. And so with that in mind, we do have a range of speakers who have joined us. And when we talk about the privates and the public-private partnerships, we're not just talking about multinational corporations, we're talking about local service providers, and we're talking about others who are even implementers, right, who are also able to contribute to the current response. And so we hope that you guys are able to pick up on that level of diversity in the conversation that we have. But of course, you're welcome to challenge us and ask your own questions throughout. We will provide instructions for how you all can do so as part of the conversation. But without any further ado, and given our delay, I'm going to go ahead and transition into our first speaker, who has joined us today from the Asia Development Bank. He's Dr. Patrick Osewe. He's the chief of their health sector, and came to the Asia Development Bank from the World Bank, where he was also overseeing their Healthy Societies initiative. Dr. Patrick has worked on a number of issues, including UHC, NCDs, and TB. He also has been a part of the US CDC and USAID in the past, and so he has a breadth and depth of experience, and we're very happy to have him kick off our conversation today. Thanks again. Dr. Osewe, over to you.
Hello, can you hear me?
We can hear you just fine. Thank you again for joining us this evening.
Hello, good evening. I can't see the slides.
We have those here, and we are starting with your COVID-19 situation, epidemiology.
Is it
Hello, Dr. Osewe. If you're speaking, we are unable to hear you, unfortunately. Can you try again?
Can you hear me?
We can hear you now. Thank you.
Okay, I'll use my computer because I can't see the slides on your screen.
Apologies.
Yeah, no problem. Yeah, so thank you very much for inviting me to be part of this. I think this is an incredible opportunity to share with you what we are going through here in the region. So as we all know, for those of us who are tracking the pandemic, as of today, there are over 5 million people that have confirmed cases, and more than 328,000 people that have died. This is a major crisis, the worst crisis since the last pandemic, the last major pandemic that we had that ended in 1918. Going to the second slide. If you look at the economic situation, this crisis has caused the worst economic situation, worse than what we had in 2009, the financial crisis in 2009. The economy basically contracted at that particular moment by the GDP by 1.67%. But this crisis so far, it's projected that in 2020, the economy will contract by 3%, which is a serious contraction because the economy is supposed to be growing and they have to absorb the number of people that are graduating every year, the number of people are looking for jobs. And if it's contracting, it shows that we have a serious problem. And if you look at Asia and the Pacific, which for almost the last 50 years, except for dips here and there, has been an economy that is growing, we foresee that it will fall by 2.2% instead of growing. The growth this year was supposed to have been 5.5% without COVID, which is a significant expansion of the economy. So as an organization, the Asian Development Bank is the second largest development bank in the world. And for this COVID, we have allocated $20 billion to basically finance response activities across all sectors. We are convening partners to be able to share knowledge and coordinate each other because this requires coordination to be successful. And we are also generating evidence to inform policy. Now, I was asked to talk about public-private partnership because this is a very critical sector to partner with to be able to be successful. For example, when the pandemic started in Wuhan, in Hubei province of China, there was a serious crisis, and the Chinese moved very quickly to shut down the province of Wuhan. But then they needed to provide supplies across the province. This is the industrial province of China that the bulk of Chinese manufacturing, particularly for medical manufacturing, is from this province. And so the capacity was completely stretched. And so we provided funding to a private sector company that had headquarters in Wuhan to be able to ensure that the supply lines, the logistics of supply system was in place. So basically, it was to support a company to rapidly provide essential equipment, personal protective equipment, and essential medicine. Because there's no way the state would have been able to do this without the support of the private sector. Second, the biggest challenge that we are facing currently in almost all countries is the ability to test, testing capacity. And when we talk about testing capacity, we just don't mean testing someone and that's it. You test the person, if they're positive, you identify the immediate contacts, and then you isolate anybody who is infected, and then you quarantine the others for 14 days. That requires massive infrastructure. There's just no way the state alone can do that and test the millions of people that are required. So countries that have been successful in our region are countries that have engaged the private sector to use private laboratories, to use primary care clinics, to use pharmacies and so on, to be able to be private pharmacies, to be able to provide that capacity of human resources, the technical know-how to be able to test the people that need to be tested, to work with private sector organizations, to work with civil society organizations, to be able to trace contacts and then to quarantine those people. This is a massive undertaking that requires the private sector. This is not happening in America. It is not happening in many countries in our region. And this is something that we are struggling with. And the recognition in our region that we have to engage the private sector is paramount. And so in India, Philippines, Indonesia, and others, this is a project we've taken to be able to try and move from testing people and reaching the significant numbers that we need. As you can see from the bar charts, we need roughly to test about 15,000 people per million population.
Sorry, we have lost you again, Dr. Sue.
Transport Service Administration, and they implemented certain rules that then became global rules. There was no discussion around how TSA was established, how it was going to work, and so on. And our lives as travelers changed after September 11th. Now our life is going to change again, but this time we are committing that this should be an informed discussion regarding what is the best journey for a passenger, starting from when you come from home through the airport, and then you arrive to where you're going, and to hotel if you're going on vacation in Fiji or in the Philippines. What that means is that when you book, you're booking the private sector company, the airline. When you get to the airport, you get to the Ministry of Transport. The airport is owned by the Ministry of Transport. All the airport authorities, either private or public, are owned by the Ministry of Transport. And then you go through security, which is the Ministry of Interior, or in the US, Home Affairs. Then you go through immigration, which is another ministry. And then you go, when you get to where you're going, you go through customs, which is another ministry. So several ministries that you normally go through on a normal basis when you're traveling, without realizing that you're passing through 5 ministries and a private sector. So we are trying to bring all these people together to come up with a minimum standard to inform how the journey of the next passenger. And then my second last slide is basically to say that for us to be able to address COVID, we need to engage the private sector to help us with data analytics, to be able to see, for example, in India, we have red states. These are states with a lot of infection. We have orange states, states that just have slightly less infection, and then we have green states. These are states that have not had any COVID. And then an analysis is done, and so we've engaged several companies across our region to be able to provide us with support to track what is happening, so that when next time we lock down, there's a lockdown. It will not be the whole country; it will be just a portion of the whole country. This is what Vietnam did when they had a crisis in Hanoi. It was only one suburb of the capital city, Hanoi, so they just locked down that suburb. But business continued in Hanoi and so on. This idea of locking down the whole country is extremely painful to the population. And then lastly, it's just to share with you that when COVID started, there were there's significant resources that were made available. Now, the challenge was, what are the best interventions to be able to absorb this money? Because otherwise, experiences from past pandemics have shown that sometimes there's a lot of wastage because we are trying many things. So we brought in together experts from the top experts to have a dialogue regarding what are the best interventions to address COVID. And we came up with 11 interventions. If you look at all these interventions, the private sector plays a very significant role in each of these categories, whether it's surveillance and investigation, whether it's diagnosis and laboratory that I've talked about, whether it's a health workforce, which requires private doctors, private nurses, and so on. This is for this to succeed, we need the engagement of the private sector. And I'll close by just asking a few questions. The first question would be, what have we learned so far in this pandemic by engaging the private sector? This is food for thought for the audience. The second question is, what skills do health practitioners need to engage the private sector? It's not easy to engage the private sector if you don't have the skills. Many health people don't have the skills to work beyond their sector, and therefore that requires special skills to do that. Then lastly, second last, is what are we not doing? And the reason why I'm asking that question is that if we come to think of currently, there's a lot of discussion about vaccines. Are we prepared for the vaccines? Lastly, what can we do with the private sector that is so unique and so innovative? Thank you very much.
Thank you very much, Dr. Osewe, and appreciate you leaving us with those great questions for us. I think that's a perfect segue to our panel, but I want to acknowledge that you offered quite a number of rich takeaways for us in your introductory remarks, and express our gratitude again for you enduring any technical difficulties to join us at what is very late in your day in Manila. I think with that, we will move along to our panelists, but also invite our participants who have joined us today to please submit any questions into the question box that you should be seeing on your screen. That way, our moderator can be sure to pull those into his remarks or his discussion with our additional speakers. With that, I wanted to go ahead and introduce our moderator for today. He is Mr. Trey Watkins, and he is the Senior Vice President of Global Health and Corporate Responsibility at GCI Health. He's responsible for a number of things at GCI Health, including really assisting partners in how they contribute to sustainable health systems. He comes to GCI Health from having roles at Rollback Malaria at WHO, as well as the UN Secretary General's office. And so grateful to have Trey join us from GCI Health today and introduce our panelists.
Thank you, Lois. I really appreciate that. And Dr. Osewe for those introductory remarks as well. I think a number of things that we will, you've left us with some really, I think, insightful questions that hopefully we'll dig into during this discussion as well. It's really a pleasure to be with everyone today here in this virtual space. I think it's going to be a really exciting discussion. We have a really robust panel set up. As Lois mentioned, I invite participants to please do share any questions throughout. There will be a bit of a Q&A at the end of the discussion. You know, I think as we kind of set up the panel discussion, I think we would all agree that recent years have seen a real shift in the way that we are thinking and talking about public and private partnerships. But as we enter really this final decade of SDGs and the 2030 targets become closer into focus, I'm not quite sure, and Lois, you alluded to this, that this paradigm shift is translated into how we are actually working together, particularly across sectors. And now, you know, COVID-19 is really demanding this of us as we grapple with the acute needs of communities, but also the long-term implications of the pandemic. And it's certainly an all hands on deck moment. And regardless of how many times we have said before, this really is the time for bold and ambitious and collaborative partnerships like never before. Since the beginning of the pandemic, we have all seen a number of companies, including across the health care sector and others, really leap into action and pivot and adapt their strategies, their supply chains, and their investments to respond and fill critical gaps. And as we come together across sectors and industries to test new and innovative solutions, I think what's exciting is that we're also changing in real time the rules of engagement. You know, the journey to scale, as we'll hear from our panelists throughout the next 30 or so minutes, is really iterative, and it is certainly not without challenges. I'm hoping that through this discussion, we can really dive into some of the on-the-ground accounts and explore what is working, and equally important, I think, what's not working. I'm joined by a really great set of panelists. In the interest of time, I will just give a very quick top-line introduction of each as they join us. We have Bobby Jefferson, Vice President and Chief Technology Officer of DAI Global Health, where he's working to expand DAI's range of digital health services and using private sector digital health interoperability and cybersecurity solutions to support international development projects with USAID and the CDC. Dr. Susan Mukasa is Vice President of Anglophone Africa for PSI, where she oversees governance and strategic implementation of health programs in 9 countries across East Africa. Dr. Mukasa brings a wealth of experience working across sectors to improve health outcomes, including with governments, major donors, multilaterals, and pharmaceutical industry. Welcome, Dr. Mukasa, excuse me. Courtney Roberts is Director of Global Health Philanthropic Partnerships at Eli Lilly and Company, where she oversees the company's philanthropic efforts, including those related to the 30 by 30 initiative, which seeks to improve access to quality healthcare in resource-limited settings for 30 million people on an annual basis by 2030. In this regard, she's leading a global team working to identify and implement high-impact public-private partnerships in countries all around the world. And lastly, Silvana Sinha is founder and CEO of Prava Health, which is the fastest growing consumer healthcare brand in Bangladesh, and really reimagining healthcare in the country through a vertically integrated network of outpatient health centers powered by international standard doctors, diagnostics, and technology. So welcome to all the panelists. I really appreciate you being here in various time zones and battling any technological challenges. Susan, I'd like to start with you and just kind of dive right in the interest of time. And I am going to say before we start, if the panelists can just try to keep responses to about 3 to 4 minutes, and then we'll just get a couple of questions in for each of you before we move into the Q&A. So Susan, I'm going to start with you. You know, PSI has always been, in my opinion, at the forefront of these discussions. I am a bit biased, having started my career at PSI and working with you and colleagues. But PSI really does blend public and private approaches to deliver essential health services in communities around the world. And I'd love for you to just tell us a little bit more about what this looks like in the context of COVID-19, when we see our systems being stretched beyond imagination. We see so many services being, at risk of being stalled or even halted altogether. So I'd love your perspective and a little bit more about what PSI is doing to continue essential service delivery.
Yeah, thank you so much. I'm so glad to be a panelist, and I really enjoyed that presentation from Dr. Patrick. As we all know, of course, COVID has presented huge challenges, but as you know, PSI, we've always worked with governments, and most of our work is at the country level, and we totally respect the fact that governments are the stewards of health systems. And prior to COVID and even during COVID, I think that the big focus has always been, at least for PSI, to try and bridge the gap between the public and private sector to ensure provision of affordable and quality services to vulnerable populations. We all know that in many countries, policies and the regulatory environment may hinder access to quality care, especially for the private, through private providers. So PSI, especially now during COVID, because COVID has heightened the need and the importance of this strong collaboration between sectors, we've had to plug in right at the global level and national level to try and see what contributions could we make at the policy level, with policies being churned out on a weekly basis to help focus on things like task shifting and deregulation, so that we can crowd in the private sector. Some practical examples that I can focus on is in line with the supply chain. Like in many countries in East and Southern Africa, HIV self-test kits are being distributed through both public and private sector, especially through pharmacies, and sometimes online. We've had to tweak, and that required a lot of negotiations at both the global level and national level, working with governments to kind of help with deregulation. We've had to do multi-month distribution of ARVs through community-based distributors, and also family planning for short-term methods, so that at least issues of self-care, because during constrained restrictions, especially under COVID, at least the people who needed the care have access to that care. We think one thing that is critical is, yes, we need to respond to COVID because COVID has constrained many economically, socially, and the health. But we shouldn't lose the gains we've had, especially with the other health, in the other health areas. Malaria net distribution, with restrictions in individual countries where we are unable to do, the mass distribution net campaigns as we've done in the past because we need to respect social distancing. We've definitely had to negotiate both global and at a country level to continue with net distributions. Interestingly, an example is South Sudan, where it's always hard to do distributions in countries like South Sudan, but we still managed to continue because of the flexibility of various stakeholders, and we did distribution of nets, respecting all the COVID standards that required social distancing. So I think it's all been about innovations around policy, around supply chain, around demand generation using digital health to promote self-care during this time, because all these measures are really needed to reduce the demand on the public sector, especially now when sites need to focus on urgent care due to COVID. And honestly, without the private sector, the pharmacies, the small, the informal and informal sector, it would be a big challenge.
Thank you, Susan. I think that's really, you raised a couple of really, I think, interesting points. I think first and foremost, the importance of coming together and leveraging skill sets across both public and private to, above all, reduce burden on an already burdened system, right? So thinking really flexibly, strategically, innovatively about how we can do that. Thank you for those contributions. Bobby, I want to come to you next and get a little bit of your perspective on this. I mean, I think as Susan's saying, it's part of what is so, part of the power of the private sector really lies in its agility, right, and its flexibility. And so in light of COVID-19, I know DAI is really working in this way to adapt its work, particularly across your network of startup companies, to help respond to the real-time needs of communities in the countries where you're working. So I'd love just to dive a little bit deeper into how you're adapting and the importance of that adaptation, particularly from the private sector, to meet some of these challenges.
Great, thank you, Trey. Thank you, Lois, and Dr. Patrick Owiso, thank you as well. So again, I'm Bobby Jefferson. I'm Chief Technology Officer for DAI on the global health side. I've been supporting and working with startups for quite a number of years, and small and growing businesses. And many of them have had excellent tools around track and trace and HIV, loss to follow-up, and community health workers and mobile applications. And so what we're seeing is that their innovators have now really adapted towards using and expanding their tools towards COVID for both triage and screening and education. What we're also seeing is a proliferation of a huge number of mobile applications as well for digital screening. So one of the things that have helped some of the private sector companies work on is how to achieve that at scale. And one way to do that is working with mobile network operators. And so we're supporting and working with Airtel in India and Safaricom and others to have some of the screening tools available, so that way they're at scale. But what the challenge tends to be is that many of the newer tools have not learned the lessons of the past. And those lessons are that, we have to make sure that they still are interoperable with the public sector tools such as DHS2 or with, some of the national systems. So we're trying to help the private sector to make that linkage. So that way their data, information that are being collected, both have privacy, that they have cybersecurity, and that they can be shared with the ministries of health later on, because we know that not all the applications and all these fancy tools and case reporting tools that people are working on today, that all of them won't be necessarily used 1 year, 2 years from now. So by making their data interoperable and accessible now is important. So we published a paper with my colleagues from Measure Evaluation, Jim and Manish, on this topic. What does the future look like in digital 3 or 4 years from now? For larger businesses, the question really becomes, how do they pivot So we've been working in the with garment companies who are doing fashion and apparel and fashion wear. And some of them have shifted to production of disposable outerwear for doctors and nurses and surgical gowns and vests for emergency personnel. And why that's important is we can build up the local capacity in country. It reduces the pressure on the international supply chain if you can develop, capacity locally. So we're also pivoting and helping countries to have access to private sector companies for those types of demands and needs as locally in the country as well. So those are the big items that I'm working on. But all of these have unintended consequences. So who knew that frontline health workers would be targeted who are working in COVID? So we've seen this in Latin America and other countries. Who knew that with the stigma and discrimination that you're being surveilled and tracked, and now if you turn positive, there's a huge data record that that surveillance countries are using to keep track of you. So we're trying to help the private sector and the public sector address these issues. So thanks, Trey.
Thanks, Bobby. I really appreciate that, and really, I think, interesting contributions, and exciting to see how exactly as we're talking, how do we really, what does pivoting look like? What does adaptation look like, right? And how can we forge those really meaningful partnerships in a way that does just that, or that allows, particularly at the local level, that level of adaptation and flexibility. Silvana, I want to come to you next and talk a little bit more about your experience in Bangladesh. I think Bangladesh is really in an interesting situation. I mean, you and I have talked. I think it's traditionally been dependent on international aid and public assistance, and has largely allowed the international community and NGOs to take the lead on health. And as a result, the country's made remarkable progress across social indicators, but my guess would be that during a time of crisis like we find ourselves in now, that leads to a unique set of challenges with fairly limited institutional capacity at the government. Prabha was really quick to respond to the COVID-19 situation in Bangladesh, and earlier this month, you were one of the first private labs granted permission to scale testing and screening through your international standard labs, which I think we would all agree is quite a step. But I would love to know if you might share a bit about more what this process has looked like, and what you think this sort of collaboration with the government might mean for the future of public-private partnerships in a country like Bangladesh as we move forward.
Thank you for the question, Trey, and wonderful to be here with all of you. Yes, Bangladesh is definitely an interesting case, and in fact, compared to other arguably similarly placed markets like India, our neighbor, public-private partnerships don't have a strong record of success in Bangladesh. And so I think the current crisis is really challenging us to figure out how we can work together. And I think our relationship with the government has really flourished during this time, which has been wonderful. And I think given what everyone has shared, really, we're all resource stretched. We're all really, trying to figure out what role we can play from scratch. I think it's really it's been kind of inspiration and motivation for everyone to play well together and to get at the same table and figure out what we can do together. And so I hope that it'll be an opening up of those types of collaborations. I think we're seeing it slowly, but it takes time. And I do think that, the government did find itself in a really different situation, because as you mentioned, in the last generation, we've seen is the NGO sector, the public sector really leading, like organizations like BRAC and Grameen have done tremendous work in terms of improving investments in primary care at the community level in Bangladesh, and the government has paved the way to allow that to happen, but they haven't necessarily been leading figures in that progress. And but in a moment like this, it's really impossible, and we're seeing this in many countries, including arguably the United States, for a country to face a challenge without coordination at the national level, And so We'll have to see how it goes. Bangladesh is still toward the beginning of our journey. The curve is actually still getting steeper as we speak, unfortunately. So we certainly are, trying to do our part. And I think the best part about it is that the government's been really open to collaboration. They're even turning to us, asking for advice on different ways we can build infrastructure together. And so I do really hope that it'll be an opening and will pave the road for more of this in the future, more of this type of collaboration in the future.
Thanks, Silvana. I really appreciate that. I think one of the things that strikes me in what you've raised is this importance of coordination, right? As everyone kind of scrambles to consider their role, right? The idea of coordination and thinking through how we all come together in a multi-sectoral way to drive really kind of meaningful progress against this pandemic. So appreciate that and congratulations. Courtney, I want to come to you and kind of zoom out for a moment. We're talking about our global response to COVID, and it is not lost on me that we have not yet mentioned the United States. I think in a number of ways in recent years, we have seen a shift in the way we're thinking about corporate responsibility. Many have started shifting from more traditional philanthropic efforts to a focus instead on strategic investments and sustainability across the supply chain. Your company, Eli Lilly, responded to COVID-19 globally, but also made investments here in the United States in your own backyard. And so I'd love for you to tell us a little bit more about that and why that was important for the company. And Courtney, I think you just have
great. Thank you, Trey, and thank you, Lois. Oh, I think I am unmuted. Can you hear me?
Yep, we can hear you. Sorry, there was a bit of a freeze. Sorry.
Okay. Great. Sorry, I'm having bandwidth issues as well. So thank you for having me here today. And we know that, as you just mentioned, global health is also local health, and this has never been more apparent than it is right now. And being one of the largest employers in the city of Indianapolis and in the state of Indiana, we have a really important role to play here locally. Lilly has partnered very early on with the Indiana State Department of Health with support of the Food and Drug Administration to accelerate testing here in Indiana. We launched a drive-through testing facility at our corporate headquarters for active frontline healthcare workers and Indianapolis first responders. In early April, we then expanded this testing to people who are considered essential workers and still need to go into the workplace, as well as people in high-risk categories, so people over a certain age who may be experiencing symptoms. My mom actually also was tested in this phase at Lilly. Lilly has also we are also now partnering with the state of Indiana to scale up that testing throughout different parts of the state as well, and not just within the center of the state in Indianapolis. We've also partnered with the governor of Indiana and the mayor of Indianapolis, professional sports teams, and other community partners to establish and institute a social media campaign called #InThisTogether to emphasize the continued importance of social distancing during this time. And a lot of this really stems from again, like I said, Lilly is a pharmaceutical company and a healthcare company, but we are also a major employer in the city of Indianapolis and the state of Indiana. And this has been a really important role that we've played for a long time and that we've continued to play during this crisis.
Thanks, Courtney. I think really exciting to hear of the investments that you have been making for many years, as you say, but how you've kind of evolved those and adapted to meet the needs in current kind of climate. I think I'm struck by a couple of things that you say. On one hand, we so often talk about essential jobs, and we forget that there are people behind those essential jobs. Right, and so I love that you're talking about essential workers, essential people, and ensuring that they're staying safe as well. And secondly, I think when we talk about kind of the communications, the social media campaign that you've really taken on, I mean, we're seeing that's such a huge problem in our current context and current climate is this infodemic, so to speak, right? This swirling misinformation that really only perpetuates fear, stigma. Bobby, to your point. So kudos to you. It's great to hear about that. I want to follow up with you, Courtney. You know, Eli Lilly is also one of the first companies that that joined on to COVID-19 Therapeutics Accelerator, which we all know was initially backed by the Gates Foundation.
Yeah.
Together with Welcome Trust and MasterCard. Now others obviously have joined on. I think personally, and I think I would not be the only one, that this is just such an exciting example of business coming together, not as competitors, but as partners with one collective goal in mind. And so I'd love just kind of to unpack that a little bit with you, right? In terms of why that sort of a partnership is important for Eli Lilly. And how do you think that sort of thinking or collaboration might be changing the game?
Yeah. We are energized that the industry has actually come together to defeat the virus and bringing all of our resources together with other partners to find a solution. And we are willing to work with all interested collaborators, governments, academia, and other companies to share data and expertise in order to combat this. And as you referenced, we joined the cross-industry collaboration with the Bill and Melinda Gates Foundation to accelerate the development and manufacturing of and delivery of vaccines, diagnostics, and treatments around COVID-19. And this group will actually work together with regulators in the WHO to help ensure that anything that's promising from vaccines to drugs to diagnostics can quickly be scaled to people around the world, particularly those at highest risk. We are also participating with the NIH to speed and vaccine and treatment options. This partnership will develop a collaborative framework for prioritizing vaccine and drug candidates, streamlining clinical trials, and coordinating regulatory processes. So I think what you're seeing right now is everyone working together on multiple fronts as quickly as possible to accelerate the science. And I think that is the only way that we are going to be able to combat this is by everyone collaborating together in multiple different ways.
Yeah, I could not agree more. I think it's just such, you know, the two initiatives that you're talking about, both the accelerator and then also with the NIH, are just such examples of partnerships based on shared value. I think in a time when we would all agree we need it the most, right? And I hope that you're right in that this is really a signal of times to come in terms of how we are working together to accelerate science. I know that these sorts of partnerships, as we all know, are not without challenges. You know, earlier this week, the WHO met in a historic virtual setting in a historic 1.5 days and adopted a COVID-19 resolution that really urges for a multi-sectoral response to the pandemic. When I think about that, I'm filled with a lot of hope. I'm also filled, if I'm honest, with a little bit of skepticism in that I ask myself, are we really as a community fit for purpose to really do that? And I think the initiatives, Courtney, that you're talking about are a huge stepping stone, right? A huge leap in that direction. But Susan, I'd love to kind of come to you on this. I think for me, and what I'm kind of getting at is that there's always been a bit of a disconnect in global health between global rhetoric and local implementation, right? And as PSI is working with governments across East Africa as a member of several national COVID-19 task forces, helping to inform a multi-sectoral response that does fully leverage resources across both public and private sectors, formal and informal. I'd be curious to hear a little bit more from you about how you feel policy discussions and some of the partnerships, the really exciting partnerships that Courtney's talking about, are starting to kind of translate, or equally important, not translating, right, to local action so that we can learn from those lessons.
Yeah, thanks, Trey, for that. And indeed, we've always seen a challenge. We've always had a challenge when, you have an excellent global policy that's agreed to by a number of partners. And once it gets to a country level, and more specifically to a district level where it's supposed to be implemented, it's really challenging. I think one thing that we've really tried to do, and maybe there have been extreme benefits, especially during COVID, is to sit at both the global and national level and try and get the community to think practical. We need to be pragmatic. We need to move as quickly as we can. And so our role has really been to advocate for those practical aspects in policy. When you think about, I talked about issues of task shifting. We've had huge challenges in the health sector where you want specific cadre of staff to be doing certain work, and it's not possible. When you think about COVID and the needs for COVID, where you're talking about testing and contact tracing and the communications, especially with restrictions, it has been a challenge. But what we've done is, right from the WHO level, sitting in those committees and then taking these sometimes complicated policies, but trying to break them down into manageable pieces, working with governments to translate these policies into actually practical ways, adapting them in the communities we work, and being flexible. And I think governments have really noticed that. I think that initial around March, many of the countries we work, governments were really focused on, oh my God, let's just focus on COVID. We need to get COVID under control. It's going to be locked down on the essential services for people tracking COVID cases. And quickly we said we're going to lose a grip on all the other health areas. And I think governments have been very practical, going back and forth from, we've really worked hard with different stakeholders as that bridge to say, the private sector is not an enemy. The private sector is actually a partner and a strong complementary partner to public sector. So we've seen very positive, I think, changes, especially because of the pressure on human resources, where governments are willing to work with a number of partners to get these programs implemented. So it's really been issues of innovation. How do you look at a policy? How do you adapt it to the context? How do you look at distribution? We've had constraints with restrictions where distribution of essential medical supplies is not able to happen because of the shutdowns. But countries are always innovative, and especially people at the forefront. We've had things like Uber borders. Whoever knew that a small little motorcycle could do a lot to facilitate door-to-door distribution of medicine, and do it safely. And interestingly, one thing that I've always struggled with is when we don't trust the actual caregiver. I think we've had policies where we say we need to do directly observed therapy, for the first dose, like for a malaria dose for a child. We've had to ease those and trust a caregiver and trust that they'll give that first dose of anti-malarials. So I think what COVID has done, especially at the implementation level, is help governments embrace the private sector, help governments appreciate and all stakeholders appreciate that the caregivers can indeed do a lot to contribute to the health of actually their own the people they are looking after, and I think that, of course, the jury is yet out. We are monitoring. We're doing the best we can to monitor these using digital services. It's impressive to see this webinar. It's all digital and it's doable. So we're yet to see what the impact will be, but I think COVID has really helped us embrace the private sector in ways, both informal and informal, in ways that we will appreciate later.
Yeah, thanks, Susan. I think that's really you raised some really I think valid points. I'm struck that so often and really, if we're honest, I think too often we think about innovation in global health and healthcare as sitting in a lab wearing a white coat. And we don't, I think we do a disservice to ourselves and to the community, and really, as you're saying, to those on the front lines who are not simply in a lab, when we don't also think about innovation in the way that they are thinking on their feet and adapting quickly to meet the needs of their communities. That's real innovation, right? And that's where I think can bring some inspiration. I also think you speak about really breaking down global policies into ways that can be practically understood and taken up by governments at a national and then even local level. I think that's just it for me. So much, and much of my career has been at that global level, right? But thinking about these policies in a way that often feel very abstract, right? When they start to come down to a national, even a regional level. And so as they start to make their way down to that end user, how are we working with governments to think flexibly and practically about what they mean and how they're implemented? I think Silvana, Susan raises a really great point in saying that COVID has really helped to kind of open up the government to private sector engagement. I think, I'd love to unpack this a little bit with you, just based on your experience with Prava in Bangladesh and some of your previous experience. I think when we think about the future of public-private partnerships, I'm really thinking, particularly in a time when the value of multilateralism is being questioned, and the private sector, I think, will play an increasingly important role. I'm really kind of thinking about how we better incentivize cross-sectoral collaboration. I'm going to give you a moment to think about that while I just remind the audience to please do send in some questions. We have some coming in, but we will start going into Q&A shortly. So please do, if you have questions, send them over our way. Silvana, over to you.
Well, thank you. It's a great question. Although I missed the beginning of it, I'll be honest. I think I had a little bit of connectivity issue, but I think generally the question is about how to create incentives for public-private partnerships.
Yep, that's right.
So yeah, I think it's a great question, and to be honest, it's something that I think about a lot because and I think about it, I worked at the World Bank in a previous part of my career, and I think about the role of multilaterals and development finance institutions in supporting work like the work that we're trying to do at Brava now. And frankly, it's challenging. The World Bank's made a large allocation for COVID response in Bangladesh. ADB has similarly done that. But the rules around the distribution of those funds generally depend on the government to decide how to make allocations. And I think the donor community can play a role in saying, we'd like to see some of these funds go to public-private partnerships, especially in a country like Bangladesh, where the government traditionally hasn't played as much of a leadership role in terms of healthcare. So I think that it would be wonderful. It would be wonderful to see that. And I also think it's a push-pull. Like we joined a group of other telemedicine organizations in Bangladesh to create a telemedicine working group, and we engaged through our own personal networks, people who were involved with the government, and have now been lobbying the government to make things easier for telemedicine providers. So Brava, because we have I like to call it a brick and click service delivery model. We have brick and mortar, and we have our own pharmacy. So we already had a pharmacy license and didn't have issues with prescriptions, but a lot of the telemedicine providers had issues with e-prescriptions, for example, and we were able to fast track getting approval on the e-prescriptions. And so I do think that that it does end up being a little bit of a push-pull, and like all of the players start to introduce incentives when the situation is so fast-moving and the needs are so tremendous.
Yeah, I tend to agree with you. I think particularly you're not only at the local level being a push-pull. I think that makes absolute sense. That I'm also thinking, and I'm really struck by what you're saying about the role of international donors, right? To help to the extent they can in their relationships with recipient governments, to really help to impress on the government the importance of allocating a portion of those funds for public-private partnerships to do many of the things we've been talking about on this panel, right? So I really,
if I could just say one more thing on the role of multilaterals, and I think you
yeah,
and I have talked about this in the past.
yeah.
One of the things I really struggle with when I think about the future, and I think we're all living in such uncertain times, and none of us can probably, well, somebody will be right, I guess, or more right than others, but none of us really knows what's going to happen, or how this is going to play out in the coming months and years. But you know, as certain countries are doing a much better job of containment, and being a lot more aggressive with testing and isolating and contact tracing, and even within countries like the United States, certain states are doing a better job of that than others. If there isn't a coordinated approach between countries, the virus is not going to be contained. You know, it was less than 5 months ago when it was literally in a market in a small town, a small city in China, you know, and now the entire world is on lockdown. And so we have to have a coordinated approach. And I think I'd love to see more from the multilateral organizations and UN agencies, to really force that kind of coordination.
Yeah, absolutely. I think that's a great point and really valid. And one of the things that I think about a lot is within that coordination, what is the role of private sector as well, right? When we start to think about kind of the role of private sector from a surveillance and data perspective, from a system strengthening perspective, et cetera. So, you know, I think there's a lot certainly that the private sector could do in that space. But you're right, so much of it depends on really, to an extent, turning flipping the conversation that we've had traditionally, right, and reevaluating the systems that are in place, and where there are opportunities. Lois, I'm struck as well, you know, thinking about the Global Health Council and its role, thinking about, you know, how advocates come together and really start to urge more allocation of donor financing for public-private partnerships, more broadly as we think about needed as we move forward. So thanks for that, Silvana. I'm going to come back, Bobby, to you for one final kind of wrap-up question. I want to touch on something that you hit on earlier that I think is really crucial. You know, you mentioned some unintended consequences that have come up, right, in terms of protection of frontline health workers, stigma associated with positive diagnoses, et cetera. I think we all know, and we're taught on a regular basis these days, every time we try to log on to a Zoom call and pray and cross fingers that technology works, we know that even the best laid plans don't always go as intended, right? And so I'd love to just kind of circle back to some of those unintended consequences you mentioned and dive into how you're adapting, how you're responding to those, and what some of those lessons might look like.
Great. Are you able to hear me?
We see and hear you. Thanks, Bobby.
Excellent. Finally got it to work. So what we've seen is that this amazing pushback that's happening within countries when people are either diagnosed or are working with COVID patients, how they're being targeted and as within the community, whether or not it's just the association of being associated with people with COVID, or as we're seeing increasingly, mobile applications and phones recording your COVID status, and that goes into a database in a system, and then you're tracked for how long the surveillance system is running. So what we're trying to do is, are there lessons that we can apply from both the HIV and the Ebola epidemic that needs to be applied urgently, both at the policy level and at the data level, around protecting the healthcare workers, protecting the privacy and the GDPR, the HIPAA associated with the collection of information of people. Today, there's we've always seen that where data is collected and the government has democracy and transparent, and then the government changes, and now that same data that's being collected can be used for not good purposes. If you have the list of people by tribe or gender or sex or MS, all these sorts of things. So we're working at the forefront on the DEI side to help. I'm doing trainings on cybersecurity and policy and trying to really address this issue, but it needs to be at the advocacy level today before it's too late. And that's the sort of area that I'd really like to see a little bit more emphasis, is helping protect both the frontline health workers and the protection of their data and information as we begin to share, and it keeps it stored.
Thanks, Bobby. I think a really timely and relevant set of challenges, and no small task, I think, to take on, but really really happy and helpful to hear what you're doing across your network to tackle those issues, particularly in real time, right? We're living, I think, as Silvana mentioned, in really uncertain times, and so we have to act quickly and on our feet, and so really appreciate those contributions. Maybe I'll start to just open up to some questions, if we have any from the audience, as we start to kind of come to the last bit of the discussion. A reminder that you can then type in those questions, and then we can get those over to the panelists.
Okay, so this is Lois again, and I'm happy to jump in and give people a sense of some of the questions being offered. Thank you again for sending those in, everyone who has flooded us with your so there's one, Trey, about how we measure the maturity of public-private partnerships in global health. Example, supporting and assessing the maturity of these partnerships in healthcare systems.
Yeah, I don't know if there's any. I'll maybe hand that to the panelists. If there's any, don't all jump at once, but anyone eager to take that one on. I think it's a really interesting a question about how we are measuring kind of the maturity of our public-private partnerships. And Lois, I don't know if that was for someone specific.
No, it was not directed to anyone specifically. So if there are examples that anyone has to offer, that was one question that we had received.
I could say something. I could say something. Yeah, just because we've been always trying to work between the public and private, trying to pull them together. And one aspect that we always track is because I think governments sometimes have genuine concerns in terms of quality of service provision through the private sector. And what we try and do is, because most times the regulations, the rules that the private sector that are set are kind of onerous on the private sector. So what we've done over time, and especially now, is try and break it down into kind of have a compromise, not necessarily limiting quality, but meeting the private sector halfway. And I think we assess maturity in specific locations when governments are willing to take on different private sector channels. For example, a pharmacy network, and government is, confirms that these are part of our service delivery system. We believe then we've reached our goal, because at the end of the day, if you're thinking about sustainability of services, especially through the private sector, government needs to be on board, and they need to recognize them as such. So we have a few indicators here and there. It could be even, domestic financing. Is government able to recognize different private sector outlets and say, yes, they have a vote for domestic financing? And to us as PSI, when that happens, we are happy. And we believe that particular sector is mature, or that particular private site is mature.
This is Bobby. Just a brief response. So, I've been working and collaborating with my colleagues from UNC, University of North Carolina, and others around how to measure health information systems maturity, a maturity model. And a subset of that is around private sector technology and data. And so they've developed some indicators of how to measure the contribution of of businesses, of technology, of the private sector side to the public sector side, and all the way from, you know, they don't attend any of the ministry meetings. They just develop things on their own. There's not aligned with the private sector, not aligned at all with the public sector's interest. They're going completely different, to all the way to things are sustainable, run by the private sector, private clinics or hospitals or solutions, and that the reduction of donor funding is reduced, and the increase in the impact funding and other private sector social impact investors is actually brought to the table. So we've been, you know, collaborating and working on some indicators around the maturity of both not just private sector but the technology use within the sectors.
Yeah, thanks for that, Bobby, that addition. You know, one of the questions that we see coming in, and it's one that I've thought about as well. I'm going to just kind of offer it up and welcome input. But is that we find ourselves really in a similar situation than we have previously after SARS, MERS, Ebola, et cetera. And so it feels as though we continue to have a very similar conversation, a bit of a Groundhog's Day, if I may. And I think that's really part of the impetus of this conversation, right? Is how can we stop to just have that same conversation and instead move forward in a really practical way? And so the question is really kind of what we've learned concretely from some of the past experiences that maybe we see being applied now, and what new learnings in terms of public-private partnerships might be coming out of this particular crisis, though it's early in stages.
So I'll just jump in. I mean, I think the most obvious one is that I think governments and pharmaceuticals need to come together on a vaccine. You know, I mean, I think that has to happen, and I think that, you know, Bill Hazeltine and others have spoken very critically about how this should have happened after the last 2 incidents in the last 20 years. So yeah, I think that's the most obvious opportunity for us to, you know, try to avoid repeating the mistakes of the past.
Yeah, thanks, Solana.
I think just a contribution on that. I think we keep going through this vicious cycle because of maybe a few things. I mean, I'm just going to mention 2 issues of commitment to specific standards, and I think there we as stakeholders who work with the private sector need to support the private sector to commit to that, because one challenge that we sometimes see, and it could be because of different incentives, there's a lot of tweaking of standards. It has actually happened during COVID with the diagnostics, where a number of diagnostics have been released that don't necessarily, you know, meet the standard. So how do we assure, you know, commitment to these standards, so that when we go into partnership with governments, it's a real partnership with very clear values. I'm not saying this happens across the board, but there's always that lack of trust because of you know, either botched experiences. Then issue of coordination and knowing that, you know, the market system as it is, public cannot serve all the needs of the people. When you look at where the people want to go in most countries, especially now even in COVID, there's fear from the general population to even access services in the public sector. So how best do we maintain the issues of coordination and trust and governments embracing that we are one market system, and together we can only manage to maintain the health of populations if we worked well together and in a coordinated way.
Indeed. One additional question that's come in, and I think is really interesting, is as we think about not only within the COVID response, but beyond, any suggestions from panelists on how local businesses, medium enterprises, or employers might best work with local municipalities or health departments? So how do we think about engaging really at that local level, right? Some local employers, local companies or businesses to engage with local ministry or municipality. I don't know, Silvana, if you have any thoughts on that.
Yeah, I think we have to be really forthcoming with data, and I think we have to support the government in sharing what we're learning, not only about our patient populations, but even about, about the best, reagent test kits that we can access at the most affordable price. And so I think that's really incumbent upon us in a situation like this to be really open with the government on all of those learnings.
Yeah.
Mm-hmm.
And I really want to compliment what Silvana is saying. The issue of documentation of success. I think we always struggle at that level where you find, organizations that they just do the work. They, especially the private sector, doesn't really like documenting to show evidence that indeed it is because of the work they have done that has contributed to this success. So I think if we could support, especially as we come out of COVID, there are a number of private sector companies, even at the lowest level, that have come in to play a role either in the supply chain, distribution, or actual service provision. If we could document that and at least show it as evidence and invite them to share how they have done it, we may see some traction thereafter.
Yeah, I think in the interest of time, I'm going to ask one final question and then give my wrap up. I know we started a few minutes late, so in the interest of time, I'll wrap up. One final question that's been asked, and it's really top of mind these days, is thinking about how we ensure. Certainly, we've seen movement, and Courtney, we talked about kind of the industry coming together to accelerate science. Once we have a viable vaccine, therapeutic, et cetera, how do we really ensure equitable access to those tools and innovations? From a global level, again, Susan, this goes back to our kind of former conversation earlier in the discussion, right? Having those big global policies that call for and urge equitable access, but what does that look like on the country and a local level? And how do we ensure that?
That's a tough one, Trey. That's going to be a really tough one, given the fact that I think for once we are faced with the whole globe, is faced with this challenge. And when you think about all businesses, let me think about the economics. All countries want to open up, and one thing that they want is good testing and a vaccine. So unfortunately, we always think equitable. It's going to be challenging. I worry about Africa. I worry about the more vulnerable parts, because I think and I can't blame anyone if Europe and America and Asia develop this fast. They need to take care of their own populations, and so it calls for governments in vulnerable areas like Africa to get together for once. Honestly, get together, pool your resources, and have a targeted approach. The only way we are going to do it is really have a targeted approach where the vulnerable come first. Luckily enough, Africa has a young population, so maybe we may survive that way. But I feel it's going to be a tough one because of limited resources and how quickly everybody wants it.
Yeah.
Any other thoughts on that one? Just an easy question to end with. Cool. So thanks everyone for those responses. Thanks for all the, I think, really exciting and interesting questions that came in. I'll attempt to kind of wrap my head around everything we've discussed and give a couple of just kind of very brief overarching closing thoughts. I think I'm certainly leaving this discussion inspired. I'm going to land on a couple of words that all start with an I for ease. I'm feeling inspired, and I'm feeling, you know, that you know, for me, as I said, the impetus of this conversation really did come very much similar to the question that was asked of the audience member. We find ourselves having this same conversation over and over. Why? Right? What are we learning? Why are we not learning? And how can we apply this in a really practical way to move forward? I think we've heard in this conversation some really concrete examples of how the private sector can complement public sector. I think we've heard certainly and discussed and unpacked a bit of those challenges and how we might address them. When I think about the role of the private sector based on what we're talking about, I'm struck by a couple of things. I'm struck if we go back to Dr. Osewe's opening, we're talking about the private sector a role to help from an infrastructure perspective, right? Building capacity to scale, to expand. Silvana, you talked about this. Courtney, you've talked about this. In fact, all of you have. Susan, Bobby have all talked about how in your own unique ways, leveraging private sector from an infrastructure perspective to really scale. Yeah. I also think we're talking about private sector from the perspective of innovation. And again, really going back to this idea of not limiting ourselves by thinking about innovation when we talk about solely medicines and vaccines, therapeutics, diagnostics, and in a lab setting, but instead thinking about how we are really working together to think about our partnerships innovatively, to think about how we're delivering to our communities innovatively, right? And the last, I think, is really this idea of implementation. So we've had infrastructure, we've had innovation, and now implementation. And I think I mean that from two perspectives. One is implementation when we think about continuation of essential services. And I think implementation when we talk about policy. Right, we spent a lot of time talking about this divide between global rhetoric and local action, and I think that for too long has been the divide, has been the gap, right? And so, Susan, I love your talking about how you are working really as a bridge to governments, right, to help break down global policies that may seem really abstract to instead discuss or think about in a really pragmatic way. I think to do these sorts of things, what I'm hearing will require a couple of different pieces. One is to really reconsider the systems that we have in place. Silvana, you touched on this a bit, thinking about whether the multilateral system in which we operate really is fit for purpose for public-private partnerships, and what we can do to reconsider or reshape or define some of those systems, and really encourage or push the envelope really to encourage greater collaboration between public and private sector. I think we also talked a lot about the importance of coordination, not only among private sector companies. Courtney, the industry initiatives that you're talking about, I think give us such hope. But also thinking about how we're coordinating between public and private. Again, Susan, to your point of being a bridge, right? Bobby, you're doing very similar work, kind of serving as that facilitator and that bridge with DAI. But also, Silvana, you've mentioned the need for coordination at a national level and greater coordination globally across borders and across markets. I think we're all being reminded of that really acutely, right? That this will require all of us. It is all hands on deck, and we have to have that greater sense of coordination. And finally, I think this idea of just meeting in the middle. I think, Susan, you talked about this a couple of times, the importance of having the kind of working with the government to meet the private sector in the middle, right? For too long, I think private sector has been a bit of a dirty word. We've seen again that shift, but we're not quite there, right? And so really continuing to be that conduit and help the government really come to the middle, and equally help the private sector come to that middle ground as well, right? So I think you've given us certainly a lot to talk about or to think about as we move forward. Some really grounded in some really concrete examples. I thank you so much for your time. I will just leave with this one parting word, and then Lois, hand it over to you. I think, during this pandemic, I've been personally thinking a lot about the idea of space, what it means, and you know, what it means under lockdown and isolation, and importantly, what does space mean for folks who have been traditionally pushed to the outskirts of space? I've also been really inspired by our ability to create and hold space for ourselves and for each other. I think that's really, really important. And so I want to just give a huge thank, Lois, to you and your team, Hayab and all at Global Health Council for their work to really organize these discussions and allow us the opportunity to hold space and to have really insightful and open discussions. So huge thanks, Lois, to you and your team, and again to all the panelists.
Well, thanks very much, Trey. I can't say much more than that, certainly not better than you just did. So with that, I'll close it out. I will give my regards to the panelists as well, but also to all of the participants who hung in there with us, and some who even said, hey, I could have asked more questions and gone on longer. So maybe a testament to us maybe doing this again later this year. But we'll give you all your time back now. And just, again, thanks very much for the work you're all doing in this fight. We can only be successful together in our minds. And so let's keep working towards a finish line in all this. Bye, everyone.
Thank you.
Thanks, everybody.
Bye.
Thanks, everyone.